because diseases do not recognize borders and healthcare challenges are more global than ever. It is time to have an electronic health record technology that is not based on a local health system, nor on an insurance network, and yet could be connected to both of them. It is time to have a cloud-based electronic health record that is accessible from any location around the world, that saves time for patient and for providers, that avoids duplication of tests and unnecessary delays in care while protecting patients' private information. It is time to have a healthcare technology that integrates patients' data in a dynamic way and provides an analytical platform for enhancing public health around the world. It is time to have an internet-based healthcare record that could be accessed in case of travel, in case of emergency, or routine medical visit. It is time for a healthcare card to represent who we have become, citizens of one world, and to provide us with safety net and easy access to critical information whenever we need it and wherever we need it.
My name is Francesco Ciccone. I own CKRX Enterprise, which is a prescription discount card, New York RX card, New Jersey drug card, Connecticut drug card, and pet prescription discount card. We are a nationwide service. Our program provides a point-of-sale discount with your prescription medications. Everyone is eligible. What sets us apart from our competitors is that our program is completely confidential. We do not share anyone's information. You can download a confidential card from the website, take that card to your favorite pharmacy, you get a discount at the point of sale. You'll need to show that card once. It works anywhere in the country. NCORD discovered the New York RX card and contacted us. And we've formed a relationship since that time. And together with my organization, we're going to help promote and market this program nationwide. We've invited a bunch of you here today to see and learn about this product. It is a new product. It is definitely on the forefront, and it will be a vital part of healthcare in the future. So can you imagine having all of your healthcare information in your pocket, in your wallet, in your purse? If you're allergic to something, it's on a card, okay? No more duplicating medical records. No more going from one facility to another facility, having to fill out duplicate paperwork. Are you allergic to this? Are you allergic to that? Have you had a tetanus shot in the last 6 months? You'll have all of that on one card, translated into any language, anywhere in the United States, anywhere in the country, anywhere in the world. Simply pull it out, show it. Imagine the amount of money that saves in healthcare services. It's quite simple. Why hasn't it been done before? Security has been a real big issue. People want to keep all of their information to themselves. They don't want it out there. This card does that. So we're quite excited about it, quite excited about it. And through the help of many people sitting in this room, we'd like to work with you to present it to as many people as possible and get this ball rolling, because again, this is a vital part of the future of healthcare, and I think it's going to be tremendous.
Now that's easy to do for a lot of companies. It's hard to do for each company as well, because our audience is 7.2 billion people. So Steve, what do you do? Okay, what are the first places you ought to take this product? Well, thinking outside the box, which is what I've had the privilege of doing most of my career, I thought, well, there's a lot of different places we could take this, whether it's an institution, a country, a medical delivery, an insurance program. They're all possibilities. The market is extraordinary. We, here in the United States, and most of us in the room, we got the golden ticket. The golden ticket is we can provide for our families. We're all very well educated, but the majority of the people don't have that golden ticket. They're dependent upon an institutional government, a friend, a family member, to provide for them when they have an illness. Now, all of us give. All of us give in one way or another. A lot of you have given your life's work in the spirit of helping others. Some of you are directly providing medical care for others. Now, this is an enormous challenge when you're faced with that sort of opportunity. But every opportunity starts with a single thought. The thought is compounded. It's introduced to other people. You bring other people into your thinking. They improve your thought. If you're smart, you'll listen. As that collective wisdom is encouraged by the practicality of a real circumstance, you'll come to some conclusions. We've already seen the outbreak of infectious disease in locations that have developed worldwide fear. We're in the hope business. Our hope is that we can improve the lives of other people directly. But as a veteran of multiple startups, I suggested a model client's approach to our strategy. Well, what's a model client approach? Really simply stated, a model client is a client that will begin to use the software, just as recently demonstrated, help test its performance and service. But not only will do that, but will help us improve the concept. Not consume all the company's resources, but give back. And most importantly, most important aspect of that is that feedback. With this concept in mind and with my experience, we started to stratify the markets. You can think of enormous countries with tremendous resources. Those are probably A opportunities. The B opportunities might be immediate revenue or an opportunity to brand. The C opportunity might be a lesser market. Next, we started to stratify the markets by not only geography, but by type of channel. And we're going to go through that in detail, so I'm going to skip some of that detail. But let me just give you some thoughts to ponder and think about, reflect. What about medical tourism? What about pilgrimages? What about the people who attend an event? Or perhaps a religious pilgrimage to, say, a religious site. There was an outbreak of infectious disease not too recently ago where, in fact, it was a very scary thing for the people attending and for the host country. What about governments? Because most of the governments around the world provide health care. They are the health system. But not only that, you have the bifurcation of the interest groups in the United States, for example, as a result of insurance, Obamacare, et cetera. What about defense? These are all opportunities.
Moving forward, I would like to give you an overview about the other verticals of NCORD Healthcare. The global EMR market is expected to grow from about $4.3 billion in 2009 to about $10 billion in 2015, with an estimated CAGR of about 15% from 2010 to 2015. NCORD's eHealthCare system has three key attributes. It carries substantial quality of data securely in a compact and computer-readable form, which differentiates it from other non-eHealth cards. It ensures security and confidentiality of data, which are the pillars of practice. And finally, systematically connects all healthcare service providers and recipients online anytime and anywhere on the live wire. That is, subscriber of this card and respective service providers can connect 24/7 to access and provide relevant service and respective information through one point of contact online for a very efficient, economical, and speedy service. Apart from eHealthCard, NCORD Healthcare also operates in a fast-growing $87 billion biotechnology industry. At present, NCORD Healthcare LLC has the following verticals. We have worldwide hospitals, blood banking, diagnostic laboratories, bone marrow registries, cancer solutions, patient registries, lifestyle solutions, cord blood banking, Planned Parenthood, stem cell research, surrogate parenthood, and disease tissue repositories. These above verticals will all be connected by this eHealthCard.
Thank you, everybody. I could save my son's life. That would be the personal experience which I would like to share in just few sentences. He met with an accident, he got locked and I had his medical records. I could save him. I'm traveling to almost 56 countries promoting the live wire, which we are trying to explain you, by which ministries, health ministries, armed forces, police department, hospitals, insurance companies, aviation ministries. For example, in India, every year almost 50 million to 100 million people travel, tourists. Like Saudi, people go for Hajj, and I think traveling globally, not the travelers, but our kids go to the school. My wife goes to the workplace. I go to my workplace. Health, I think, is the most neglected commodity. I think in this busy world, we must rethink about the fundamentals, that if my health is all right, my family's health is all right, then I have achieved a lot in the whole process of this race. Today we are ready with 183 countries and their demographics, their websites in their own language, keeping their records on country-wise servers. You are getting connected with blood banks, cord blood banks, bone marrow registries, hospitals, almost 500 cancer hospitals, post-cancer situations. I think what I expect when I go to my doctor, transparency. He should treat me with complete transparency, and it should be done ethically, fast, accurately, because life is precious. I think this card can contribute, can express our care for our family, for ourselves. And for $89, spending 4 minutes, we must spend these 4 minutes. We must spend these 4 minutes, and then we should empower our own selves for a better healthcare situation. Thank you. Thank you once again. Thank you for your time. Thank you for your participation. I thank my co-dreamers, people who came from all over with this commitment that there should be something new, something pragmatic, which can support all of us in, at that golden hour. Thank you.